Yes, friends. So, in continuation with the menses therapeutics, next drug that is a very important symptom of the drug I tell you, and you must have seen those symptoms in patients, but maybe have failed to prescribe that drug. Whenever a young woman comes to you and says that there is eruptions on the face, Doctor Sahab, जब भी periods आने का रहता है ना, whenever the menses are going to appear, there are all eruptions on the face. Then you must think about this drug. That is Sanguinaria. Sanguinaria has this symptom, eruptions on the face as soon as the menses are going to appear, and the menses are especially scanty. So scanty menses with eruptions on the face, a classical symptom, a very thematic symptom of Sanguinaria. You must always think about, there are 3-4 drugs also. First is Eugenia jam, a very important drug for echinacea. Second, Sulphur. Third, Calcarea, and fourth is Soranum. These 4 drugs have the same symptoms, eruptions on the face in women before menses with scanty menses. Now this is a single symptom which is so important in Sanguinaria, and I have used this drug with only this symptom with wonderful results. So sometimes we miss out on the case के we feel by this is normal eruptions, तो physiological disturbance eruptions तो आएंगे face पे, but no. In homeopathy every symptom is important, especially during scanty menses. If a woman suffers from eruption on the face, my dear friends, doctors, think of Sanguinaria, think of Eugenia jam, think of Sulphur, think of Soranum or Calcarea. A very important symptom. I have used this symptom in case of Sanguinaria in many of patients with excellent results. Next drug, again a very rare drug, but a singular symptom which is very important in this drug. Here the drug is Sarsaparilla. In Sarsaparilla, though it is used for urinary complaints, now in Sarsaparilla the most important symptom is pain at the close of urination. That is urine symptom. We always remember that symptom. But if a lady suffers from eruptions on the forehead, सिर्फ forehead पे eruptions, I told you Sanguinaria on the whole face. But if the patient comes and tells you कि सर सिर्फ ये forehead पे मेरे को eruptions आते हैं, so eruptions on forehead during menses, then you must think about Sarsaparilla. See the differentiating mathematics in homeopathy. Every symptom is so important. Eruptions on the forehead, drug difference. Eruptions on the face, drug different. So eruptions on the forehead, always remember Sarsaparilla. Also you can remember Eugenia jam, Sanguinaria, Soranum also, because Sanguinaria covers the whole face. Next drug, you must have used it in your practice many of times, that is Secale cornetum. And Secale core menses are irregular, copious and dark. See, irregular, copious and dark, but fluid, with pressing pain, a labor-like pain in abdomen. See, this is important. Menses irregular, copious and dark. Many of drugs have that, but fluid blood. That is important. Secale core with pressing, labor-like pain in the abdomen, copious, continuous discharge of watery blood until the next period. But this patient will come, and you must have seen many of patients, Doctor Sahab, when the period start, it does not stop. It keeps continuing until the next period. Then again the menses start. Then again slowly there is discharge of fluid blood. मतलब पेशेंट कैसे बोलेंगे, लेडी आके डॉक्टर साहब पीरियड्स तो आ गया, 4 दिन अच्छा फ्लो हो गया, लेकिन बंद ही नहीं होता, एक 2 ड्रॉप चलते रहता, धीरे धीरे चलते रहता, फिर 1 महीने बाद फिर से अच्छा मेंसेस आता, फिर धीरे धीरे चलते रहता. Now this is the wording the patient will come and tell you, that is Secale core. So discharge of watery blood until the next period is the most important symptom of Secale core. So in a nutshell, you must remember Secale core, menses irregular, dark, copious and fluid blood, with pressing pain in the abdomen, labor-like pain in the abdomen, and discharge of blood until the next period. That is important in Secale core. That is, the flow is continuous and slow. Next drug, I would call the king of all the drugs in female complaints, that you must have studied everywhere you have gone, in school, in the college, in the seminars, whatever sir you have attended, whatever doctors you are following, they use this drug very frequently. That is sepia. Now in sepia, menses, irregular menses of nearly all forms. It is written in books, irregular menses of nearly all forms. That is late, early, scanty, profuse, amenorrhea, menorrhagia, every form of menstrual disorder you will find in sepia. Normally when we were in college, we were told if you don't understand anything in menstrual complaints, at least give sepia. It will work because it has all the forms of menses. You name it in it, you have it. But with associated with prolapse of uterus and prolapse of vagina. This is important in sepia. What I have confirmed, prolapse. So if you have menstrual complaints of all forms with prolapse of uterus and prolapse of vagina, you must think about sepia. There are many of symptoms of sepia in Materia Medica. You can go home and confirm. What I have found useful in this is these two symptoms. That is sepia. Next drug, again a very rarely used drug in our practice, that is Spongia tosta. Yes, Spongia tosta. When do we remember this drug? Mostly for dry cough. It is so dry that is as if a saw is driven to a pinboard. It is so dry. But in menstruation also a very important symptom, that is palpitation violent with pain and gasping respiration. Now if you have violent palpitation with pain and gasping respiration, then you must think about spongia. The patient awakes suddenly in the midnight, suddenly उठ के बैठ जाता है with gasping respiration, with suffocation and great anxiety. This is spongia tosta. My dear friends, use this symptom. Violent pain with gasping respiration. Patient wakes up suddenly in the midnight with suffocation and with great anxiety, with valvular insufficiency before and during menses. Then you must think about Spongia tosta. So this drug is basically used before and during menses. If you have violent palpitation, gasping respiration, patient wakes up suddenly in the midnight with suffocation, with anxiety and valvular insufficiency before or during menses, the first drug, I would say the first drug you must think about is Spongia tosta. It is so much important. So Spongia tosta, don't always remember the 3 marking symptom, that is only of cough, cough and cough. But you must always remember Spongia tosta. Before and during menses, there is valvular insufficiency, there is great anxiety, there is gasping respiration. You must think about Spongia tosta. Now, next drug. This symptom you must have seen in many of ladies. डॉक्टर साहब पीरियड जाने के पहले बहुत उदास सा मन लगता है, ऐसा लगता है कुछ काम ना करो, ऐसे तब बैठे रहो, हस्बैंड से बात करने की इच्छा नहीं होती, बच्चों को पढ़ाने की इच्छा नहीं होती है, ऐसा लगता है लाइफ बहुत बोझ है, अब जी के क्या करना. देयर इज कंप्लीट सैडनेस. यस, सैडनेस बिफोर menses and pain in the malar bones during menses. If you get this duo symptom, remember this: great sadness before menses and pain in the malar bone during menses. Which drug I am talking about? Yes, any guesses? It is sternum metallicum. Now in sternum metallicum you have this classical 3 marking symptom: menses too early, too profuse. मतलब जल्दी आएगा और बहुत ब्लीडिंग होंगे. Too early, too profuse. But before menses there is great sadness, and during menses there is pain in the malar bone. This is the important symptom of sternum met. Now I have told you 3-4 drugs which are very rarely used, but remember the 3 marking symptoms which I have told you. Those are symptoms are very important to prescribe these drugs. You will get this results so fast and so beautiful that you will be surprised that how our Materia Medica is written so perfectly and so judiciously. Every symptom written so judiciously by the prover, interpreted by the doctors. It is such a classical proving of the drug. Next drug, again a polycrest, but a very one-line symptom of the drug I'll tell you, that is sulphur. Remember only 2-3 symptoms, that is menses too early, profuse and protracted. You might have many other symptoms of sulphur, but these 3 symptoms I have confirmed and in my practice and used in practice: too early, too profuse and protracted. So that is sulfur, my dear friend. In fact, these polyglot drug you must have read and read so many times in your college life, in your practice life. You must have known all the symptoms of sulfur. But what I have seen in my practice, too early, profuse and protracted, these are the prescribing symptoms I have seen in practice. So in this lecture I have given you some rare drugs inside of menstruation complaints. In next lecture I'll add few more drugs. Thank you.